When psychosocial risk appears at work, the answer is not to treat the worker as the problem. Psychosocial hazards are features of work that can cause psychological or physical harm. A practical response starts with a better question. What in the design and management of the work needs to change? Look across the work system. Psychosocial risk controls can change work design, systems of work, the work environment, workplace interactions, and the tools or objects used in a task. The point is to examine how work is organized and carried out, rather than making assumptions about an individual worker. Risk generally increases when exposure is severe, frequent, or prolonged, or when hazards combine. Those four lenses matter together: severity, frequency, duration, and combination. A single snapshot may miss the pattern, so the assessment should consider how exposure develops across the work, not only one moment. Manage psychosocial risk through a clear cycle. Identify the hazards. Assess the risks where that is necessary. Control the risks. Then maintain the controls and review whether they remain effective. The cycle is practical, not one-off. New information or changed work may send the organization back through it. Consult workers when possible controls are being identified. Consultation can reveal controls that may otherwise be missed. The people doing the work can help explain how the work system operates in practice and whether a proposed change is workable. Consultation supports better decisions. It is not a substitute for acting on the risk. Where assessment is necessary, examine the risk through the approved lenses. How severe the exposure is, how often it occurs, how long it lasts, and whether hazards combine. Keep the assessment focused on the work. A generic diagram in this video is not an assessment of any real person or workplace. Controls should address the source of risk in the work. That may involve changing work design, systems of work, the work environment, workplace interactions, or tools and objects used in the task. The exact control depends on the actual work and local requirements. This video does not prescribe one universal control. Individual support can sit alongside work system controls, but resilience training, an employee assistance program, or telling workers to speak up is not sufficient by itself. Reporting and support pathways can help information reach the risk process. They do not replace changes to the work when the work is creating the risk. Implementation needs more than a written decision. Consider the information, training, instruction, and supervision needed for the controls. Training should reflect the work, the hazards, and the controls involved. Supervision and local checks help confirm that the agreed controls are understood, used, and still functioning as intended. Useful records may include consultation outcomes, identified hazards, risk assessments, implemented controls, and training provided. Records should help the organization see what was considered, what changed, and what needs review. Documents and records support the system, but they do not replace effective controls, consultation, training, or supervision. This is general education for Australian model work health and safety jurisdictions with jurisdiction-specific codes. One code, regulation, or control does not apply identically nationwide. Victoria's separate occupational health and safety psychological health framework is outside this video's approved claim scope. Check current regulator material for the jurisdiction where the work is carried out. This video does not diagnose mental health conditions, provide clinical treatment advice, or assess a real person or workplace. It does not guarantee compliance, prevention of harm, workers' compensation, employment, or legal outcomes. Use the approved process, apply local requirements, and verify controls in the actual work. The practical message is simple. Identify, assess where necessary, control and review. Consult workers, change the work system, support implementation, and keep useful evidence. BlueSafe can help organize practical work health and safety documents, consultation, actions, and records around that process. Get started free with BlueSafe.